All right, so now we are going to be talking about cervical checks. Ugh, I know. This is basically how a cervical check is done. Your care provider will get you into a position very similar to how you probably had one done for pap smear or anything like that during your pregnancy. It's going to be basically the same while you're in labor. Biggest difference is you're in labor. They will insert 2 fingers into your vagina and then they will spread them to feel how wide your cervix is. Now, the biggest problem with cervical checks is it can vary based on who does the cervical check. Some people's fingers are longer, some people's are shorter, some people's are bigger, some people's are smaller. So that can add a lot of variation to the cervical checks. Accuracy of cervical checks increases slightly when you give 1 centimeter on either side variation. That increases the accuracy to 89 or 91%. So basically what that means is that whenever you are cervically checked, keep in mind that it has a 1 centimeter margin of error. You're either 1 centimeter further than they think or 1 centimeter less than they think. So now the question is, are cervical checks a good idea? This is between you and your care provider. This is not medical advice that I'm presenting. But scientifically, getting your cervix checked, if you're further along than you thought, then great, you got a good boost and you're ready to go. But more often than not, when cervical checks are done, you're not as far along as you thought you were. And that can cause discouragement and disappointment, and also fears that if it's been this bad so far, then how can I do that much more of it? If I'm only 3 centimeters, I can't do all of this again to only be 6 and then do all of it again to be 10. And the biggest comfort for no matter which cervix check you get, or if you get any at all, is that cervical change can happen quickly or slowly. Being told that you're 4 centimeters doesn't really give you a timeline for how much further you have to go. When you're at 5 centimeters, that doesn't mean that you're only halfway through your labor. It could mean that you're 3/4 of the way of your labor and those last 5 centimeters are going to go more quickly. So talk with your care provider, talk with your partner and your doula, and create an ideal plan for, do you want cervical checks? How often would you like to have them? And incorporate that in your birth plan, because if you're a person that, if I hear my cervical check is and it's super low, then I'm going to be discouraged, then avoid them at all costs. Like, the hospital may have a required amount of times that they have to cervical check you. So look into that in advance. And if you want to change care providers or change doctors, you are more than welcome to do that. And if you're the type of person that the unknown is stressful to you, then get cervical checks. It's totally fine. I have more information below and have a link to evidence-based birth on cervical checks. So now the question is, okay, no cervical checks, then what? And we talked earlier in the course about your body language in labor and how that can help your partners and care providers observe and get a basic idea for where you may be in your labor. Again, if you're chatty throughout, in between contractions and only mildly discomforted during contractions, then you're probably in early labor. They don't have to check you to know that you're not 10 centimeters yet. And 10 centimeters is really not even the sign that it's time to go anyway. The true normal progression of labor sign that you are ready to have your baby is the urge to push. Just because you've reached 10 centimeters doesn't mean that you're going to be ready to push. It could mean that your body needs a few more contractions until you're just ready to go. The important thing is to push when you feel the urge to push. Pushing too soon can cause extended amounts of time pushing, and it can cause your cervix to swell. So make sure that you're listening to your own body, especially if you don't have an epidural or anything like that, then listen to your body. And if you have an epidural, that doesn't mean that you can't listen to your body, but just keep in mind that you might not be able to feel as many of the urges as strongly as you should. So keep all of that in mind. One of the really interesting methods of checking dilation rate is the purple line. A study showed that the purple line appeared in 75% of the women during active phase of labor, and when the appearance of the purple line was there, it predicted the progress of labor with a 90.2% sensitivity. That means that when the purple line is present, it is actually more accurate than a cervical check, which is awesome. So keep that in mind. Have your partner check it, and you don't have to be a doula or a medical professional to kind of get a basic idea. And again, this is more for you to have signs during labor to kind of give you a general idea of where things are. Because again, knowing what you're specifically dilated does not tell you how much longer you have to go into labor. So be fluid, be prepared for flexibility. The next one I'm going to show you is called the rhombus of Michaelis, which is my favorite. It is so fascinating. Using my helpful pelvis here, and we talked about it earlier in the course too, the rhombus of Michaelis is right around here. So as the baby comes down the birth canal, it's going to push on these bones and push them out. And sometimes the rhombus of Michaelis can remain out for a little while after birth until it slowly settles back into place. Now, when the rhombus of Michaelis appears, it is not a good way to show dilation. It is a good way to show that baby is in the birth canal and working his way out. It is always in the second stage of labor when you are fully dilated. So it can be one of those things where when your wife is in labor and you don't see that, then you know she's not 10 centimeters. So let's keep going and keep working with what we're doing, right? Below I have some birth practice scenarios. Now I want you to go through these together. This isn't homework, this is just an extra added benefit for you to practice what you've learned. Go through those together and practice your brain-informed consent steps and discuss together, oh, okay, so if this was us, what would we want to do? And it can give you a good idea as a couple together to help you make sure that you're on the same page. Can give the partner a good idea for what she might feel comfortable with in labor, because you should always lean into your decisions that you made before the labor. It doesn't mean you have to do those things, but lean more heavily on the decisions you made when you were clear-headed and felt more certain of everything. And then being prepared for things to change is fine, but don't just change your mind on the spot because things were harder than you thought. Give yourself some time to make sure that this is a good change of action, not a change of action made out of fear or frustration or anything like that. All right, see you at the next video.